Greetings. I'm excited to be able to join this group virtually today to talk about something that's near and dear to my heart, and that is mentoring trainees. In fact, I feel like this is probably one of the most important things that we can do as practicing clinicians is to pass on the art of medicine to the next generation and to offer mentoring and advisement to those who are interested in learning the art of medicine. I put together just a brief outline of things to address today. I wanted to briefly talk about how to set the stage for a successful precepting experience and how to potentially use didactics to make for a smooth workday. And then also how we can tie in the mission to the work we're doing. And then I briefly want to touch on some efficiencies when having students with us. So to start off with, I find that it's really helpful to dedicate a little bit of time when the student first starts on the first day. And it can be a rush and it can be tempting just to say, oh, let's just have you shadow for the first half of the day, or let's just have you see how I do it. But if you will ask the student to meet a half hour early, or if you can maybe block the first patient of the day and set the stage, you'll have a lot more success over the course of the month or the 6 weeks or however long the trainee is with you. I usually spend some time showing them my templates. And so I have all of my templates saved on a Microsoft Word document. I kind of go through each of the templates that I use with the student, and then I email them a copy of my templates. I make sure to tell them that they don't have to use my template, but it can serve as a reference or as a backbone for them to generate their own HPI and their own visit notes. I also make sure to tell the student that our goal is not to have them document and be a scribe for us. We're not there to teach them how to use the EMR. We're really there to teach them clinical medicine. If they can learn how to master our EMR, it will help make the day a little smoother, and it will probably result in better training for them too. They'll be a little more flexible and adept at using different electronic health records throughout their career. I also like to set expectations in a very kind way, but let them know that it's upon them to review the schedule for the following day. Some students will text you late at night and say, what time are we starting tomorrow? Or, asking about what they should prepare for the next day. And really, if we set the stage on the first day and let them know that it's their responsibility to look at the schedule and prepare for the day, it'll take some of that burden off you as well. I also like to take advantage of using any downtime for didactics. I know some people like to use the end of the day and maybe select a few cases that were seen that day and teach on those cases. I like to take advantage of downtime, even if it's only 2 or 3 minutes when, maybe the medical assistant is rooming the next patient. Use that time to draw out a nephron and talk about why we use ACE inhibitors in diabetes, or to go over a lab report and talk about the value of an RDW when trying to work up anemia. You can take advantage of those little free minutes to have these brief didactic sessions, and that doesn't leave you needing to go over all that stuff at the end of the day. It's nice when you finish with the last patient and you and the student can just go home for the day and process. I have found that time work we do into the mission is really good for students. I think at no other time are students in such a pure state when they don't have to worry about billing and they're not jaded by insurance companies and all those factors which maybe cause us to feel burned out at times. They haven't experienced those things yet. And so I find that it's okay to inoculate them a little bit by exposing them to some of those frustrations, but really keeping a focus on the mission, which is to improve the health in our communities. Another thing that I think is interesting is that I find my day actually runs a little smoother when I have 2 students versus 1. So if you ever find that, a time when you might be expected to precept 2 students, don't stress, don't, worry too much, because I think this is actually a setup for success. When I have 2 students with me, I have a lot more flexibility about what room to have them go into, what patient to have them see. And then if there is downtime, they can teach each other and review cases with each other. So if you do experience having 2 students with you at one time, it can actually be a benefit. For example, I may be overbooked or maybe I'm a little behind schedule and need to hurry and catch up. Rather than having to wait while the student finishes collecting a history and doing their exam and then coming to staff or precept with me, you can send another student into the next room instead of having that patient wait while you're waiting for the other student. So be sure to to strategically use having two students with you to keep the workflow smooth and keep the patient flow going through the clinic. I just want to close by highlighting a few of my mentors and talking about the major impact they had on me. One is Linda Lau. She was my residency program director, and I think there's probably no other physician who taught me more about medicine and more about how to be a doctor. I don't think there's probably more than a few weeks go by that I don't think about and feel grateful for all that she's done for me, and so I really appreciate her. I think about people like Karen Holder and Shipra Bansal within North Country who have impacted so many students and learners, including me. And I just feel so grateful for them. I know that it can be challenging at times. It can be stressful to precept medical students and nurse practitioner and PA students, but it's well worth it. We're investing in the future of medicine, the future of our career. And I can assure you that creating a good environment and a good learning experience for these students will pay dividends, and they will look back for decades to come on the things that you taught them. Thank you for allowing me to take a minute to present to you today. And if ever I can be of assistance or offer any suggestions or advice, please feel free to contact me. Have a great day.